want to begin the discussion by asking you, sir, what is TACE and when is it needed?
TACE stands for Arterial Chemo Embolisation, which basically means that the medicines are delivered directly to the target area, which is a tumor, by angiographic route. TACE is done in liver for HCC as well as for metastasis from, say, for example, colon or breast metastasis or neuroendocrine tumors. The main idea behind TACE is that the chemotherapeutic agent or the drugs which are to be delivered directly reach to the tumor in maximum concentration and do not reach to the rest of the liver. This helps us two ways. It reduces the side effects because none of the medicine or very minute quantity of the medicine is going to the rest of the body, and it increases the efficacy. A minimally invasive procedure, it is an angiographic procedure. The recovery times are quick and it can be done under local anesthesia.
In your clinical experience on the results that you have seen on the patients so far, and so with respect to the literature that exists as a backup for this, as the backup evidence for this procedure, what is your clinical opinion?
TACE nowadays is the treatment of choice for HCC, that is hepatocellular carcinoma, in intermediate stage. The TACE becomes treatment of the choice because of two reasons. One, it addresses the tumor. The other aspect to the HCC is that these tumors almost always arise in a background of cirrhosis. This makes the situation and the treatment even more complicated because the prognosis as well as the treatment does not have to consider only the tumor but also the background liver cirrhosis. And because TACE is minimally invasive, it can be done in such patients who are cirrhotic, and because it is a targeted therapy, the results are excellent. Say for example, TACE is done in these intermediate stage HCC patients. The results depend mainly on these two factors: the background cirrhosis and the stage of the HCC.
What is the cost impact analysis of this particular procedure in terms of the benefit it gives to the patient?
TACE has got survival advantages, and it is proven by multiple randomized controlled trials as well as meta-analysis that TACE renders gives us survival advantage. In minimally invasive procedure, there is no big scar there. We don't need to cut open the abdomen. This reduces the stay in the hospital tremendously. And because the hospitalization is reduced, the cost automatically comes down. So I would say to all my friends and colleagues that after TACE, when in follow-up the patient again comes to you, we need a contrast scan, either a contrast CT MRI, contrast CT triple phase, or a contrast MRI. This will give us best idea about the residual disease, recurrence of disease, and how much benefit has been there.